The way you sleep every night is either healing your body or slowly breaking it down. 8 hours every single night. That adds up to roughly a third of your entire life spent in a position most people chose by accident and never questioned once. Most people are doing the second one. Category 1. Back sleeping. We have the soldier position. You lie flat on your back, arms at your sides, body completely straight. This is the gold standard for spinal alignment. Your head, neck, and spine form one neutral line, with no twisting, no bending, and no unnatural angles compressing your joints. People who switch to this position often report that unexplained morning aches disappear within weeks. Back sleeping also keeps your face off the pillow entirely, which matters more than most people realize. Constant facial pressure from side and stomach sleeping creates sleep lines that deepen into permanent wrinkles over time. Dermatologists recommend back sleeping for exactly this reason. But here's the catch. Gravity works against you here. When you lie flat, your tongue and soft tissue relax backward, partially narrowing your airway. If you already snore, this position amplifies it. If you have sleep apnea, lying flat is actively dangerous. Excellent for your spine and your skin, potentially a problem for your breathing. Next, we have the starfish position. Same foundation as the soldier, flat on your back, but now your arms drift upward toward your head and your legs spread wide. The spinal benefits remain: neutral alignment, decompressed joints, no lateral twisting. What changes is your shoulders. When your arms stay elevated for hours, your rotator cuff muscles compress into an unnatural angle. Blood flow to your arms shifts. People who sleep this way regularly report waking up with numb arms, tingling fingers, and dull shoulder aches that take most of the morning to resolve. The snoring problem from standard back sleeping also remains here, and if you share a bed, the starfish is perhaps the most aggressively territorial position a human being can sleep in. Your body occupies every available inch. The starfish works if you sleep alone, have no shoulder issues, and keep your arms loose rather than pinned upward. Category 2. Side sleeping. Moving on to the fetal position, the most common sleep position on Earth, you curl onto your side with your knees drawn toward your chest, body rounded inward. Side sleeping opens your airway compared to back sleeping, which immediately reduces snoring and improves breathing for people with mild sleep apnea. Pregnant women are specifically advised to sleep this way because left side fetal positioning improves circulation to the uterus and kidneys. But here is where most people make the mistake. They curl too tightly. When your knees pull all the way to your chest and your chin tucks downward, your diaphragm gets compressed. Your lungs cannot fully expand. You breathe shallowly all night and wake up tired despite a full 8 hours, not because of poor sleep duration, but because of reduced oxygen intake. Your spine also rounds under a tight curl, and your hips and knees stay flexed for hours. The result is joint stiffness that worsens with age. The fix is simple: curl loosely. Let your body relax into a gentle curve rather than a tight ball. Let us continue with the log position. You lie on your side with your arms straight down along your body and your legs fully extended, forming a straight line from head to foot. This is one of the better positions anatomically. Your spine maintains its natural curve, your airway stays open. There's no pressure on your internal organs. Side sleeping in general, and the log position in particular, also assists digestion. Gravity helps your digestive system process food more efficiently when you're on your side, especially your left side. Acid reflux decreases because your stomach sits below your esophagus rather than level with it. The primary downside is arm numbness. Lying directly on one arm for hours restricts circulation and compresses nerves, producing that familiar dead arm sensation at waking. Shoulder pain can also develop over time if your mattress is too firm and your shoulder absorbs concentrated pressure every night. Rotating sides periodically solves both problems. We then have the yearner position. You sleep on your side with both arms stretched forward in front of you, reaching out as if searching for something. Spinal alignment stays decent here, and the airway remains open, so the standard side sleeping benefits apply. The problem is your arms and shoulders. Holding your arms extended forward for hours pulls your shoulder joints out of their neutral resting position. The surrounding muscles tighten under sustained strain, and you wake up with upper back and shoulder stiffness that persists well into the morning. The arm underneath you also gets pressed into the mattress, cutting off circulation and compressing nerves in the same way as the log position. Sometimes worse, because the extended arm angle changes how weight distributes across your shoulder. Placing a body pillow in front of you to rest your arms on reduces both problems significantly. It keeps your arms elevated and supported, rather than hanging unsupported in extension. Now we have something most people ignore entirely: left side versus right side. Not all side sleeping produces the same result. The side you choose changes what happens inside your body. Left side sleeping is better for most people, and the reason is anatomical. Your stomach and pancreas sit on the left side of your body. When you sleep on your left, gravity assists your digestive system with moving food through efficiently. More importantly, your esophagus connects to your stomach on the right side. Sleep on your left, and stomach acid has to fight gravity to reach your throat. Sleep on your right, and gravity helps it travel upward. Right side sleeping measurably worsens acid reflux and heartburn. Right side sleeping also places more pressure on your liver and right lung compared to the left. For generally healthy people, this is not dangerous, but it is suboptimal. The exception is certain heart conditions, where right side sleeping can reduce pressure on the heart. For everyone else, left side is the better default. Early in the night, your body defaults to whatever feels comfortable. Late in the night, it defaults to what it actually needs. That is why combination sleepers often end up on their left side by morning, without consciously choosing it. Category 3. Stomach sleeping. We have the freefall position. You lie face down, arms wrapped around or under your pillow, head rotated to one side. This is the most damaging common sleep position, and there is no gentle way to explain why. The cervical spine is not designed to rotate 90 degrees and hold that angle for 8 hours. One side of your neck stretches under tension, while the other compresses. Done repeatedly, this produces chronic neck pain, persistent headaches, and nerve impingement that eventually radiates into the shoulders and arms. Your lower back suffers separately. When your body lies flat on its stomach, the natural curve of your lumbar spine flattens and then reverses as your midsection sinks into the mattress. Over time, this creates chronic lower back pain that becomes a baseline condition rather than an occasional complaint. Breathing is also mechanically harder in this position. Your chest presses into the mattress, limiting how fully your lungs can expand. Your respiratory muscles work harder all night for less oxygen. The single genuine benefit of stomach sleeping is that it keeps the airway more open than back sleeping, which reduces snoring. That one benefit does not offset the spinal and neurological damage the position accumulates over months and years. If you currently sleep this way, retraining yourself to side sleep is worth the temporary discomfort. Category 4. Specialty positions. Moving on to pillow hugging. Sleeping while holding a pillow against your chest and abdomen is not just a comfort habit, it serves a mechanical function. When you hug a pillow during side sleeping, your top arm rests on a supported surface instead of flopping across your chest or hanging unsupported. This keeps your shoulder in a more neutral position and prevents the upper body from rotating forward, which misaligns your spine. There is also a physiological component. Physical contact with an object, even a pillow, triggers the release of oxytocin. Your nervous system calms, heart rate drops slightly, and the transition to sleep becomes easier. For people who sleep alone, the pressure of a pillow against the chest mimics the physiological effect of physical contact closely enough to measurably improve sleep quality. The main pitfall is gripping too tightly or using a pillow that is too thick, which pushes your top shoulder upward and creates the same strain you were trying to avoid. Use a pillow sized for holding, not for your head. Hold it with relaxed arms. Next, we have combination sleeping. Some people move between back, side, and stomach positions throughout the night without waking up. This is not a problem. It may actually be advantageous.
Holding any single position for 8 straight hours concentrates sustained pressure on specific body parts, compresses the same nerves repeatedly, and restricts blood flow to the same areas all night. Shifting positions redistributes that pressure. Your body is partially self-correcting. Combination sleepers often capture benefits from multiple positions across a single night. Back sleeping's spinal neutrality early, side sleeping's airway benefits later. The downside is that frequent position changes require brief partial awakenings to coordinate the movement. These micro-awakenings fragment your sleep cycles, even when you have no memory of them. You may log 8 hours and wake up less restored than expected. If you shift occasionally, that's your body managing pressure distribution. If you shift constantly, the cause is usually an uncomfortable mattress, unresolved pain, or elevated nighttime anxiety.
Finally, elevated and inclined sleeping. This means sleeping with your upper body propped at an angle typically between 30 and 45 degrees, using a wedge pillow, adjustable bed frame, or stacked pillows. When you lie completely flat, stomach acid can travel freely up your esophagus, raise your upper body, and gravity holds it down. People with chronic acid reflux or GERD often find that inclined sleeping eliminates symptoms they previously managed with medication. Airway geometry also improves at an angle. Your tongue and soft tissue are less likely to collapse backward, which reduces snoring and improves breathing for people with mild sleep apnea. Nasal congestion clears faster when the head is elevated because the sinuses drain more efficiently. The trade-offs are that inclined sleeping feels unnatural initially. Some people slide downward during the night and end up flat by morning, and too steep an angle can increase lower back pressure. For the right conditions, elevated sleeping is not just a comfort choice, it is a clinical recommendation. So, that is the full picture. 4 categories, 10 positions, each one doing something specific to your spine, your airway, your digestion, and your joints while you are too unconscious to notice. Which raises the more uncomfortable question: if your sleep position is silently shaping your posture, your pain levels, and your long-term health every single night, why do most people never think about it until something already hurts?